Hello, I am Dr. Erol Nadivarlı, consultant gynecologist. Today I would like to talk about human papillomavirus, commonly called HPV, a virus that is incredibly common yet often misunderstood. Most people who have it don't even realize because it is rarely cause symptoms, but some strains can lead to genital warts and more seriously cervical cancer. That is why understanding HPV and knowing how to protect yourself is so important. In this video, I will answer some most common questions I hear from my patients, helping you understand why awareness is essential protecting your health. Question 1. What exactly is HPV? HPV is a large group of viruses that infect the skin and mucous membranes. There are over 100 types. Some are harmless, while others can cause warts or more seriously lead to cancer over time. Question 2. How is HPV transmitted? HPV spreads through close skin-to-skin contact, usually during sexual activity, vaginal, anal, or oral. Because it is so common and can remain dormant, most sexually active people will encounter it at some point. Question 3. Can you get more than one type of HPV? Yes, it is possible to be infected with more than one strain at the same time, including both low-risk types, which cause warts, and high-risk types, which are linked to cancer. Question 4. Does HPV always cause symptoms? No. Most people never have symptoms and their immune system clears the virus naturally. But in some cases, the virus persists and may cause changes in the cells of the cervix or other areas, which is why screening is so important. Question 5. Why is HPV linked to cervical cancer? Strain high-risk types, especially HPV 16 and 18, can cause abnormal changes in cervical cells. If these changes go undetected, untreated, they may develop into cancer over time. Question 6. How is HPV tested? In women, HPV can detect during the cervical screening, sometimes called pap smear, which looks for abnormal cell changes. There isn't yet routine HPV test for men, although visible warts can be diagnosed on the examination. Question 7. Will HPV affect pregnancy or my baby? HPV rarely affects pregnancy, but in some cases, warts can grow more than quickly. Transmission to baby during birth is extremely rare, but your doctor will monitor and guide you if you are pregnant and have HPV. Question 8. Can HPV be prevented? Yes. The HPV vaccine offers strong protection against the most dangerous types. Using condoms reduces the risk but doesn't remove it completely, and regular screening remains essential for early detection. Question 9. If already have HPV, should I still get vaccinated? Yes. The vaccine won't treat an existing infection, but it can protect you against other HPV types you haven't yet been exposed to. Question 10. Does HPV go away on its own? Yes, in most cases. Around 9 out of 10 HPV infections clear naturally within 2 years, especially in younger people. Persistent infections are the ones that require follow-up and monitoring. Question 11. What about my partner? Should they be worried? HPV is so common that it's often impossible to know when or from whom it was contacted. The focus should be awareness, vaccination, and appropriate screening. I hope this has answered some of your questions about HPV. Remember, it is far more common than most people realize, and there is absolutely no shame in talking about or seeking help. If you have concerns about your risk, vaccination, or screening, do not hesitate to contact us for further guidance. Thank you.